Hello everyone, hey, including you. My name is Muji and welcome to Health Talk Simplified. On this channel, we share everything related to health, name it, but more importantly, very simplified. If you haven't yet subscribed, please hit the subscribe button below and be notified whenever a new exciting video is uploaded. Now sit back, relax, and let's get talking. Enjoy! So here is what. One day I wake up with a very painful toothache. Ouch, it hurts so bad. I tell myself no matter what, I'm going to the dentist today. I'm going to have my tooth extracted. I do not want anything else happen to my tooth. I'm just going to have it removed once and for all. Fast forward, I go to the dentist. He examines my tooth and tells me, your tooth is still okay. It still has some life. So we're not going to remove it. Instead, we're going to repair it. I thought to myself, why can't you just remove it? I do not want to come back here for the same pain. I'm ready for the pain now. But it seems my dentist knew exactly what my fears were, and the whole procedure was very painless. Fast forward, everything was done, success. Then I went to check myself in the mirror. Unfortunately, something didn't seem quite right. My face. One side of the face was paralyzed. I couldn't smile. I couldn't pronounce words correctly. That wasn't my face. It was paralyzed. I was scared. But luckily, within a very few minutes, under 10 minutes, my face came back to normal, everything resolved, and I went back home. Everything was fine. However, it's not everybody's story which is like mine. Other people's stories could last longer. So today we'll be talking about a condition that affects one side of the face. It could either be the left or the right side of the face, which causes it to be paralyzed, and that is Bell's palsy. So what is Bell's palsy? Bell's palsy, in simple terms, is paralysis of one side of the face. But what causes Bell's palsy? So there are so many things that cause Bell's palsy, some of which include infection, trauma, or sometimes it could actually come without any known cause. So how do these cause my face to be paralyzed? Once the nerve that supplies the face, known as the facial nerve, becomes swollen or compressed, it could lead to it being ineffective in the way it manages the muscles of the face, causing it to be paralyzed. So, what are some of the infections that could put you at risk of developing Bell's palsy? Some infections include the very common and the highest culprit of it all is the influenza, the common cold, a flu. Yes, that could be one of the major culprits of causing facial palsy. Okay, sometimes it could be an eye or ear infection. It could be a toothache, and that tooth infection could go in and irritate the nerve, the facial nerve. Sometimes it could be trauma, maybe a punch to around the ear, because this nerve is just near the ear area. Okay, sometimes it could be high pressure through the ear. An example is, we all love to move in open vans, or I love moving in an open van where I could feel the air blowing and all that. But sometimes that air would be too much, pushing everything in my ear. Right. So there is too much pressure in my ear, and that could irritate the nerve, making it swollen or compressed, and that could lead to one developing Bell's palsy. But who is at risk of developing Bell's palsy? Now, I want to mention that Bell's palsy does not choose age. It can actually occur in anybody at any age, but the most common ages are from 16 to 60. But I have still seen some cases in which a 4-year-old child had Bell's palsy, 6-year-old child had Bell's palsy. So this just goes on to tell you that Bell's palsy can affect anybody at any age. But those people that are at a higher risk include those who are pregnant or those who have diabetes. chances are really higher. Sometimes, if you have a family history of some people having facial palsy or Bell's palsy, your chances of developing one could also be higher. But what are some of the signs and symptoms of Bell's palsy? So I'll tell you, sometimes it's very easy to know that there's something wrong with your face because we've had our faces from the time we were born. So we'll be able to tell that there's just something not right. Even without a mirror, you'd still feel something. Sometimes some people record having a headache. Other times, you go to the bathroom, brush your teeth, your face, but as you're brushing, you notice that fluid is just trickling out. Sometimes you go and have your breakfast and notice that your juice, your tea is just trickling out your mouth. You're not able to chew properly. You're not able to keep everything in your mouth. It's just coming out because one side of the face, one side of the mouth is very, very loose. It's very, very weak. It cannot keep everything inside. Right. Some of the other signs and symptoms include inability to raise or wrinkle your eyebrows, inability to close your eye. Sometimes you would have a droopy eye. Sometimes you would also have asymmetrical facial muscle tone, meaning your muscle on the affected side just seem weak, and they do look weak. Sometimes you would have loss of the crease or the creases on your face. We've got creases. We've got creases. When smile, you've got the nose crease, you've got the smile crease, you've got the eyebrows, everything. You've got all these creases on your face. But when you've got Bell's palsy, one side of the face will have absence of these creases. Sometimes you'd have a drooping mouth and also asymmetrical smile. You would be there trying to smile, but then one side is just not smiling. So it will be like that. This side is the good side, and then this side is just not responding. That's how it looks. The symptoms of Bell's palsy could get worse after 48 hours, but the good news is within 2 weeks they could resolve. Sometimes, however, it could last up to 3 months or more. Okay, now that I've got Bell's palsy, what then are my options? Well, I'm going to tell you, immediately you notice you or your loved one or your neighbor, your friend has got something like that developing, rush them or rush to the hospital and be seen by a medical practitioner. They are going to help reduce the symptoms and prevent them from becoming worse. So depending on the cause of your paralysis, sometimes if it's an infection, you'll be prescribed necessary medication. If it's trauma, if it's anything, you'll be advised and you'll be treated from there. When you go to physiotherapy, and I'm going to tell you the mainstay of Bell's palsy is physiotherapy. And when you go to the physiotherapy department, several modalities are going to be done to you that are going to help retrain your muscles or bring them back to normal. Some modalities include facial massage, electrotherapy, home exercises, and because your eye will be droopy, it will be open, it will be failing to close, you would be advised to move, either wearing sunglasses to prevent dust from entering your eyes. Sometimes you'd be advised to have a wet cloth so that you're always wiping your face off the dust, because that could also lead to further infection. Sometimes, because it will be very difficult for you to drink from a cup, you'd be advised to use a straw instead. It would be a bit easier to drink fluids. Sometimes, even as you go home, you'd be advised to carry on with some facial exercises and facial massage that is going to be taught to you. So many other treatments will be given to you just so to help you regain your facial muscle movement. From me, thank you very much for your time. If you've got any comments, contributions, I will be so excited to receive them in the comment section below. From here, it's bye.